Thank you for coming to our virtual student health fair presentation. My name is Ethan, and I'm here with my classmates Christian, Alvin, and Gianni. We'll be talking to you about COVID-19, which I'm sure you are sick of hearing about. So, COVID-19 is a coronavirus disease, and it's an infectious disease caused by the SARS-CoV-2 virus. So we'll be talking to you about the disease, so that will be about statistics, symptoms, and risk factors. And then we'll talk about prevention, so that'll be masking, social distancing, vaccination, sanitation. And then how are we going to treat it? And then where do we go from here?
About the disease, statistics, symptoms, and risk factors. Symptoms of COVID-19. Cardiovascular symptoms include pain in chest, heart rhythm variation. Respiratory symptoms include difficulty breathing, congestion, shortness of breath. Some gastrointestinal symptoms include diarrhea, vomiting, and taste disturbances. Risk factors for COVID-19. Age. More than 80% of COVID-19 deaths occur in patients 65 years and older. Another risk factor includes chronic illness, such as chronic lung disease, diabetes, and cystic fibrosis. And another risk factor can be autoimmune issues, such as immunocompromised patients with HIV or AIDS. Some additional risk factors include interstitial lung disease, pulmonary embolism, pulmonary hypertension, cirrhosis, COPD, and alcoholic liver disease. According to data from the CDC, as of late February 2022, there have been a cumulative total of about 80 million confirmed cases of COVID-19 in the United States.
So now to get a little bit more specific about the statistics. So as Christian just told you, about 80 million total COVID-19 cases as of late February. And then for deaths, about 945,000, and cases per 100,000 people, so how many people in 100,000 that have COVID-19 has been 23,723 as of late February 2022. So that's an approximate number now. So now talking about, if we look at some graphs, maybe for some better understanding. So this graph illustrates the trend in daily cases of COVID-19 reported to the CDC. And you can see actually the recent spike in COVID cases, which can be attributed substantially to the Omicron variant. And then we've also marked some spots on the graph that are important. So at the beginning, you can see limited testing capacity. So many infected people were not categorized. So that may not be as reliable to look at. And then there's the second most recent kind of hump spike is what we know as the Delta variant. So this chart illustrates the number of daily deaths reported to the CDC. At first, yes, it definitely looks depressing because it is, but we should take a look back at the trend of reported cases and compare it with deaths. The winter of 2020-2021 generally showed more COVID-related deaths per day than winter 2021-2022. But looking back at the chart of confirmed cases, there were nearly 3 times more cases at the peak of winter 2021 rather than winter 2020 and 2021. So it is getting better. Less deaths, and we are becoming immune. And now just a quick timeline, just to show how it's progressed. So back in January of 2020, that's when we first started hearing about COVID-19, and we got our first confirmed case in the U.S., and it started to get kind of scary. And March 11th, the World Health Organization declared COVID-19 a pandemic. And then September 28th, 2020, the death toll surpassed 1 million people worldwide. It's very unfortunate. And then finally, December 11th, 2020, it's getting brighter. The first COVID-19 vaccine was approved by emergency use authorization. So now it's really looking more bright.
So as you can see, things are getting better, and one of the reasons for this is due to prevention. So, how COVID-19 spreads. There are two general ways, and the first way is person to person, and this includes small respiratory droplets through coughing, sneezing, and even breathing. And the second thing is surfaces. So droplets will land on nearby surfaces, and the transfer of these drops can go directly into our eyes, mouth, or even nose. And that is one way that COVID-19 will spread. And the thing about the surfaces is that these droplets will stay on plastic and metal surfaces for up to 3 days. So make sure to sanitize. All right, now vaccination, one of the biggest things. So there are three main manufacturers for COVID-19 vaccinations, and those three would include Pfizer, Moderna, and Johnson & Johnson, as you may have heard. All right, so age. Pfizer is for individuals 16 and older, as well as between 5 and 15 under EUA, which is Emergency Use Authorization. Moderna is a little older, so you do have to be above 18 years old to receive a Moderna vaccine, and that also goes for Johnson & Johnson. Now let's talk about dosing. So for the Pfizer primary series, which is 2 shots, those 2 shots are going to be 21 days apart, and the third dose, which would be the booster, is now to be 5 months after the primary series. And as you can see, it's 0.3 mLs if you're over 12 and 0.2 mLs if between 5 and 11. Now for the Moderna vaccine, the primary series, which is also 2 shots, is 28 days apart, and this is a dose of 0.5 milliliters. And also for the third dose, the booster, which also comes 5 months after the primary series, this is 0.25 milliliters. Now, Johnson & Johnson was only 1 shot for the primary series, and that shot is 0.5 milliliters, and the booster is 2 months after the first dose. And as you guys can see in the right-hand column, Pfizer and Moderna have the highest efficacy for reducing the risk of hospitalization or death, and Johnson & Johnson has an efficacy of between 65 and 70%, which is significantly lower. So how do COVID-19 vaccines work? All right, so we have mRNA vaccines and viral vector vaccines. So mRNA vaccines, mRNA, which is nucleic acids, create a harmless spike protein, which is specific to COVID and coronavirus. And this spike protein has the immune system create antibodies to fight off this protein. And while widespread use is new, technology has been studied for decades. And now viral vector vaccines, the adenovirus delivers instructions teaching cells to make spike protein, and our bodies will proceed to make antibodies to attack this spike protein. And adenovirus technology has been used safely in other vaccines for years. Now, all COVID-19 vaccines have gone through the appropriate clinical trials, and even though widespread use of mRNA vaccines is relatively new, this technology has been studied for decades. And just a disclaimer, mRNA vaccines do not contain any live or dead parts of the virus.
Okay, so we'll move on to how we can reduce exposure. So 3 main ways that we can go about this are through good hand hygiene. So you want to make sure to wash your hands regularly to remove any SARS-CoV-2 virus. As we mentioned previously, that's another term for COVID-19 or coronavirus. The next thing you want to do is mask. So you want to be sure to wear your mask to prevent the spread of COVID-19. And finally, sanitization. So you want to sanitize areas of high public use to prevent the spread of SARS and COVID-2 virus. So you want to make sure you keep areas clean and use disinfectants such as Clorox wipes or Lysol spray. So we'll move on to more specifics about masking and face shields. So why should you mask up? Well, two main reasons that we can give you are to help prevent yourself from infecting others, as well as protecting yourself from contracting the disease. So below we have a table here with different types of masks that have been used throughout the pandemic. So the first ones that we'll go through are N95, KN95, N94. So surgical and N95 masks both protect the wearer and others from transmission. So this would be the most effective mask to use. Moving on, we're going to use surgical masks. So this offers good personal protection and excellent protection for others. So this is also good, but not quite as effective as the N95s. Then you have face shields. So these can greatly enhance protection in combination with a surgical mask. So if you use a face shield, you should definitely use that along with the surgical mask to protect yourself as much as possible. And this will protect you from respiratory droplets. So since you have a face shield on, it won't be able to hit you directly. For cloth masks, and these are typically the most common because they're the most accessible and you can make these. It's better than no mask, and it is good for protection for others, but the protection that you have against the vaccine is very limited. So since you're wearing a mask, your droplets won't go flying on other people, but if they're not wearing a mask and they start like transmitting the disease to you, like through speaking or droplets, the cloth mask is not as effective. Next, we'll talk about some masking frequently asked questions. So the first question that is very common is there a relationship between discomfort from masks and oxygen shortage? So the prolonged use of masks has been associated with complaints of headaches, lightheadedness, as well as an increase in perceived exertion and perceived shortness of breath. But when you look at the data, it actually shows that there's no actual oxygen shortage. So you might feel like you're not getting enough air, but that's not scientifically proven to be the case. So the next question is headaches while wearing a mask and what causes these headaches. So there are many factors that can contribute to the increased number of headaches while wearing a mask, including the design of the mask, which rely on tight elastic straps. So if you have a tight elastic strap around your ears or your head, you're going to feel it after wearing it for a long time. And if you have the elastic straps in combination with a tight fit, it'll result in pain behind the ears or other contact points. And what is the best mask to use while exercising comfortably? So a lot of people go out and try to get their exercise in during the pandemic or even now, and places require them to wear masks. So if you're going to exercise, the best mask for you to use would be an N95 if you're going for protection against the virus, but in terms of comfort and easier to breathe, you would be fine wearing a cloth mask. But like I said before, they won't be as effective in protecting you from the disease. So the next step we'll go to is treatment, and we'll talk to you about that for a little bit.
So, how do I treat the symptoms? Treating symptoms such as fever or headache with over-the-counter medications such as acetaminophen, which is Tylenol, or ibuprofen, which is Aleve. Use a humidifier, decongestant, or an antihistamine, and very importantly, stay hydrated and get rest. As in many other flu-like symptoms, it can be a very helpful way to treat the symptoms. How do I get better? So one way to avoid hospitalization is monoclonal antibody treatments. So trovimab and bebtelovimab, may be used to treat adults and children who have recently tested positive for COVID-19, who are at risk for developing severe COVID-19 or being hospitalized. This treatment has been used to fight against the Omicron and has shown 99% effectiveness rate. In terms of antiviral treatments, they are not proven to be effective in reducing rate of mortality.
So now we'll move on to the conclusion part of the presentation. So in conclusion, due to the constantly evolving state of the disease, it's important to stay up to date on the latest news surrounding COVID-19. The best ways to stay informed are by obtaining information on the CDC website and always checking in daily. So below, we'll provide you here with the link to the CDC website, and obviously if you guys need access to all these links, you can feel free to reach out and we'll send them over. So the UConn School of Pharmacy has a series of videos answering frequently asked questions about COVID-19 vaccinations in adult and children, and we have those in 5 different languages for you. So if you click the link below, you can access those videos and see them for yourself. This is just a picture of our team. So I'm Gianni, I'm on the left. Ethan is who you heard spoke first in the presentation. Alvin talked about the vaccines, and Christian talked about the symptoms and treatments. This is just a list of references for you. So like I mentioned earlier, if you need access to these, we'll get these out to you. That way you have access to all the resources we use for this presentation. And we want to thank you for sticking around for this presentation. We've provided our emails below, so if you have any questions, feel free to reach out to us. We do want to give some credit to this template. So we got it from SlidesGo. And we appreciate you for sticking around. Have a great day.